sometimes I actually ask them, did anybody warn you about me? And from the standpoint of, I actually tend to talk very directly to the children, and sometimes that catches them off guard, that I expect them at age 7 to somehow know about their own health and their family history and everything. And it's always amazed me how well some even very young children do, sitting in the seat next to the exam desk and being asked very direct questions. And that's how I try to actually set up the relationship, that it really is the child as the patient with the help of the family. And it is, I think, a foundation for how we will treat the children in the years going forward as we take care of them. When I started out, I actually had no idea of what I wanted to do. There were individuals when I was a medical student who I said, wow, this pediatrics is really terrific. And then there were individuals when I was in pediatrics who helped guide me into my 40-year career in pediatric cardiology. The mother of the child, who I really do credit with having me end up in pediatric cardiology, contacted me about 35 years later and said, you know, Dr. Zahka, how are you doing? And I called her, having not spoken to her for the last 35 years. It was really a very moving experience. Because I've been doing pediatric cardiology for a long time, I have a large number of adult patients, and I'm one of the pediatric cardiologists specializing in congenital heart disease that also has an appointment in the Heart and Vascular Institute, where I see the adult patients that I've taken care of for their congenital heart disease. So we make that transition for them to adulthood even easier. And I enjoy furniture making, cabinet making, and now that our own house is filled, my job is to fill the homes of our children and their spouses. I'm also a reasonably accomplished baker, and I like to bake cookies. And when the children that I take care of are in the hospital, I will oftentimes make them cookies. The beneficiary of all this is the nursing staff and the physician staff in pediatric cardiology, who get a sample of what I also made for the kids as well. And that's who I am.